Hello, and welcome to our discussion on population health, clinical quality, and patient outcomes. Now, in your course of study for your healthcare administration degree, you do have a couple of courses, HCA 440, Fundamentals of Population Health for Healthcare Administrators, as well as HCA 435, which is Quality Improvement and Patient Safety. Those two courses are going to dive much more in depth on those two topics. However, for our discussion purposes and for the module that we have this week, we're really looking at healthcare IT data and its relationship to those items. Now, prior to this, we went over for the first four modules, really the basic IT, electronic medical record, and clinicians putting data into the system. Then we looked at what can happen to that data when we looked at disaster recovery, business plan continuity, and cybersecurity, as well as security of healthcare IT. We also discussed HIPAA quite a bit as well. But today, we're really going to talk about, and with your assigned readings and external resources, of the data that's going to be created and generated by clinicians. And this data is what we're going to take a look at with population health. PHI, Protected Health Information, is something that is governed by HIPAA. However, if you strip out the identifying information, social security numbers, patients' names, obviously, what you have left behind, that data that's left behind, can be pulled together and used for population data analysis. That is not covered under HIPAA. So any patient that presents to any hospital that has some sort of diagnosis and has treatments that occur to it will have demographic information such as age, perhaps race or ethnicity, certainly gender, demographics such as college educated or high school educated or graduate school or no education, perhaps even some stratification would be from incomes, as well as, of course, the diagnosis. So those different demographic features are really what put people into a specific population. It could be something that they have going on with them that is a population health issue, such as the opioid epidemic. So of the people that are in the hospital or have been admitted through the emergency room that have some sort of opioid issue, what do those demographics look like? Can we segment them out and make some generalizations and then take that data and actually come up with a plan of care that we can apply to the entire population? Population health has only been around for about 15 years now. Now, when I say that, it's really the term population health or the study and science of population health. Population health has actually been around for a lot longer than that, but it really wasn't coined as population health until the last 15 years. Coincidentally, maybe not coincidentally, the rise of population health has really been driven by the rise of the use of the electronic medical record. Because once we have the data that's put into the system, into a database that can then be mined or can be collaborated with other databases, and then merging that data together or utilizing that data in concert, then you can actually make some sort of assumptions or some sort of come to some sort of conclusions based upon that information. The electronic medical record has made that easy. Prior to that, using paper and pen, it was a lot harder to cull through that data to come up with any kind of population characteristics, which also made it very difficult to manage patient quality, as well as to really manage any of the outcomes and see what kind of successful treatments and evidence-based medicine had been used for a specific patient or a group of patients or a population of patients that has some sort of characteristics. Virtually impossible with paper and pen. As a matter of fact, population health has become so, I don't want to say popular, but certainly has been a major field of study, so much so that there are programs popping up around the country at universities specifically for population health. So you have a course on population health. That's one course in your undergrad course. University of New Mexico, for example, was, I believe, the second, and I don't know who the first was, but was the second one to offer an undergraduate degree in population health. A number of universities are now offering, such as University of Alabama, are offering population health graduate programs. So there's been real big push towards that. What you're going to find today when you go through the task list and your assigned reading and resources are quite a few external resources. Again, the book, because of when it was published, really doesn't have a lot of information about population health. Part of it's because the topic is not really explored. Part of it's because it was not as well understood, or how to bring it about 6 years ago and how to put it into some sort of a healthcare IT educational process. So a lot of the information that you're going to see is relatively recent, within the last 2 or 3 years. Some of it will be in the last 6 months or so. So when we're taking a look at the population health, clinical quality and outcomes, those articles that you're going to be reading, and please take notes on those, as well as the videos that you're going to be watching, and please take notes on those, are going to be key to understanding how data and how clinicians who put that data into the database drive the ability for us to do population health. In the beginning part of this course, it was a lot of rote learning and memorization. You know, what is a computer? What is the healthcare IT structure? What kind of positions are in a healthcare IT department? So it was really identification or describing more than anything. But moving forward, what we're doing is we're taking that knowledge and that information and applying it to certain modules. In this case, population health. Prior to this would be security and data recovery. And then taking that application and telling me what you see. It's not just a quiz of did you read this, although there is a quiz that is associated with this module. But it's also take the information that you've learned from the external resources, from the discussion with your peers, and take that and write a paper, a position paper. And there's 2 for this particular module that really will help you understand better about population health and the impact on clinical quality. The papers. As we go along in our studies, there will be less quizzes. I think I mentioned that, although we do have the pop quiz from last time, as well as the quiz for this week. But I'm really interested in your ability to get information across. If you look at the rubric really is heavily tilted towards the ability to write. That is going to be key. It doesn't matter how much you know when you get out into your job. It's can you articulate what you know? And that's why less than half of the position paper is the actual points, and more than half of it is the articulation of it, the flow, the sentence structure, the effort. And part of the effort, and people have asked me, what's the effort grade based upon? Well, the effort grade is based upon how much research you did. If you did research, and if I can tell from looking at what was offered that week as an external resource or the lecture, and did you go over and beyond that and look for things on your own? You don't necessarily have to quote it, but I know that if you looked up information and presented it in the paper, that you didn't get it from what we discussed. And that's okay. That's the whole anticipation, is you're going to be critically thinking, and that you're going to be exploring other avenues to obtain information. Because again, when you get out with your degree, this is what you're going to be doing on a day-to-day basis with your job. The ability to also take the constructive advice that I put on your prior paper or your prior papers and have you utilize that. So if I see that there's sentence and grammar issues, have you corrected that? If I see that there's some flow issues with your paper, have you corrected that? Have you taken the recommendations and suggestions that I put on the paper and actually applied it to the next paper? That's part of where the effort comes from. So anyway, quite a bit of external reading. Please take notes. Again, the videos will be very important. There's one video where I only want you to look at it from, I think it's minute 3:30 to, anyway, it's on your assigned reading list of the segment that I really want you to watch. If you want to watch more than that, you're certainly more than welcome to. But again, we're going to be looking at how data impacts population health, clinical quality, and patient outcomes.